Perfect. So, I guess again, thank you for taking the time.
No, no
And
worries. It's good. Yeah.
it's a real privilege to speak to somebody who's gone through, well, I guess all of their academic steps right to the top, and then come into
Well,
a
yeah,
different.
I would. Yeah, I don't think I'd say that. I think when you're a PhD student, it sounds fancy, but you are like the baby training in the lab. Like PhD is just training. That's all it's a training position in the lab. It sounds fancy on the outside, but yeah, it's you are the absolute baby. So yeah, thank you, but I don't deserve that.
So, I guess to start off, for people who
Mhm.
are unfamiliar with your story to medicine, could you just give us
Mhm.
a brief overview of where you started at to currently where you're at now?
Yeah, I suppose even during A levels, I've not kind of stuck to one path. So I did psychology, economics, maths, and geography at A level, and then I took a kind of quite a standard gap year. So I didn't do any science at A level. So no, I didn't do science A levels at the beginning. I took a gap year, and I think that step back let me think about what I wanted to do. And I was set to go to do psychology at university, which obviously would have been really interesting. But I had kind of fallen into it in part of that cycle in sixth form where it's like, what are you going to do? And stepping back from that, I thought, actually, I'm really interested in science. So the next year, I self-studied biology and chemistry A level just from home, got my A levels for those two, and I applied to biochemistry. Kind of, again, I picked biochemistry because it sounded interesting. Someone had said it was quite hard. It was one of the, so I saw a bit of challenge in that. I'd gone to an open day at the University of Leeds and really loved it. So I started that degree. I did a year abroad at the University of Western Australia. So I got some really nice experiences traveling, seeing different universities, trying out different modules. And then really enjoyed my degree, really enjoyed my third year project, being in the lab. I love the problem solving element, and then you get a result. And yeah, I really love that. So I was quite sure at that point I wanted to do a PhD. I had thought about medicine, and medicine I think is one of those things where I've always been fascinated by it, but it didn't feel like it was quite for me. Like I think I had a self-confidence doubt of just I think I just doubted that I could do the role. To be honest, you seem to doctors just seem up here, don't they? And I
Yeah.
just don't think I could see myself there. So, and I was really enjoying the lab, so I applied for PhDs as I was coming out of university. I did a year where I got some experience in the lab, I got some small projects, and then the year after that I started my PhD. I got some funding at the University of Bristol. And again, I did really enjoy it. It's challenging, definitely one of the hardest things I've done, and it's very different compared to medicine. And during my PhD, I did quite a few other things. I was teaching for a charity called the Brilliant Club. I really enjoyed that. You get to write off your own material. That, and I was a senior resident in halls, so for 3 years, so it was quite a heavy pastoral role. And I also worked as an assistant practitioner for the Terence Higgin Trust. So I had all these different experiences that I all really enjoyed. And then after my PhD, kind of staying just in academia, felt like I wasn't going to experience all these different elements. So that's when I really seriously started to think that medicine could try and bring all these different experiences and skills that I'd learnt together. So that's kind of how I came to the decision to apply to medicine. And I suppose as well the confidence was then there a bit more to think, yeah, okay, I could do this. I could do this.
Yeah, and I guess it's obviously, I don't want to put words in your mouth, but having
Yeah.
having that experience of going through all of going through academia and obviously ticking all the steps of doing your
Mhm.
undergrad, doing your postgrad, doing
Mhm.
your PhD, to get to that point and think, well, is this the area I want to stay in for the rest of my
Mhm.
life? Which, at the end of the day, if the path that you took was quite a number of years. So
Yeah.
normally people do stay in that for the rest of their life. So for you to divert, was that more due to a sense of there was not much like helping people? Obviously, me
Mhm.
now studying a biomedical science degree, it's
Mhm.
you probably understand it's more you're in a lab, you're touching cultures, not people. Is Was it more of a sense of you wanted that patient interaction more at that point?
Yeah, I think so. I think I do enjoy working with people, and obviously you have your team within the lab. And I think it was also with the science. Like, I still would really love to stay in research, but I think I wanted a more obvious connection between the science I was doing and then the kind of the results in it. So I think I would love to work on some more clinical science and science where, the result is very clear what you've helped. So I'd love to stay in research. And I think the people element, and medicine just has so many options. You can teach, you can research. There's so many fields that you can go into, and they're all so diverse and different. So I think there's so much about it that appeals as a career, including also the kind of the patient facing side, and just the challenge as well. Like, it's absolutely a challenge to go into it, and I think it develops so many different skills. It's not just academic skills at all. Like, you're having, for me, to develop a lot more kind of communication and confidence and working under pressure. And I think I looked as well the thought of developing myself and being challenged in a lot of different ways. I think that appealed a lot as well.
Yeah, I guess going back to that in that with medicine, it's one of the unique subjects in which you get your result almost not straight away, but it is within the near future, compared to research when you can be doing experiments for multiple years. And it's you probably understand the pain in that. It doesn't always work out, and those years are, well, not wasted, but they're not the way you want it to go. So I guess medicine offers that closure of, if it's more of an instantaneous, I don't want to say relief, but you're getting that. What's the best way to put it? You're almost having shorter projects in that you're treating patients, and those results are coming more and more often rather than having lengthy periods of time.
I'd say so. And I think even if, a lot of illness, like, you're not going to, I think if you go into it thinking that you're going to be just curing people left, right and centre, that's, not right. But I think even if you're not resolving someone's illness straight away, or you're not having an answer, you're able to make a difference in how you communicate that, and in every kind of consultation. So every patient interaction, even if you're not, curing their disease, or even if you don't have an answer yet of what's wrong, how you deliver that and how you go forward with that can still be successful in its own right. So I think you can still come away from that feeling like, okay, well, I've done that as well as I could, or I've done that well. So I think it's still going to be challenging, though. I think there's going to be, patients that maybe you don't get to follow through with, and cases that you can't solve. But research is definitely frustrating. Most of it doesn't work. Most experiments don't work. But it's that moment when they do, though, it manages to hook you just in time. So, you'll be working something for months, and it'll just fail, and then you're getting so frustrated, and then something will work, and it just keeps you going. But I think it just takes a lot of perseverance, and mostly.
So I guess to start off from the beginning of your application process, I guess you applied during your PhD, or did you finish your PhD and then?
No, I decided to apply while I was finishing up in my final year. I hurt my foot quite badly, and I was in a boot, so I couldn't get into the lab. So I was stuck at home, and I think it was I kind of had time to sit there and contemplate a lot more. And it was during that time that I had a moment where I thought, I think I might apply for this. But that was maybe April, May time of the cycle. So I just had till October to get my application together.
So it does sound like it was very last minute for you to sit.
It was a little bit, and then, I think it was, I'm obviously glad now that I did it, because, I was able to, I wrote up, finished in end of June, I vived in August, and then I started in September. And I'm quite glad that I was able to go straight through. But it was stressful. It was trying to write up, especially because when you're writing up, you're just at home. or you're just there writing, there's nothing to distract you really. So I was checking UCAS, checking student room obsessively. So yeah, whether it was a good idea or not, who knows, but it was, yeah, interesting experience. Yeah.
So I guess in terms of that then, what work experience or voluntary experience did you undertake to support your application then?
So at the beginning of my PhD, I'd done 3 years as a senior resident. So obviously that's not clinical, but it's very pastoral. You work within a team. You are kind of, you're overseeing a small group of students to see how they're doing. I did a small stint as well as deputy warden to cover for someone for a few months. So that was showing, I suppose, a step up in seniority. So I was able to, I think the thing with work experience is you can get a lot from a lot of different things you do. I think there's some places, especially for grad med, where proper hands-on clinical experience is what they want. And Warwick, I'm sure you're aware, they need they want hours of you in a clinical experience with, absolutely fair enough. But I think especially for other applications and for undergrad applications, they're not expecting you to have done clinical work. So I think you just need to look at what you have done, and I think you can pull quite a lot of things from a lot of different experiences. So I had my pastoral care for 3 years as a senior resident. I had done this training as an assistant practitioner at Terence Higgins Trust. So I was doing kind of sexual health clinics, HIV testing. So that was, I suppose, a bit more of a clinical side. And those, I suppose, were my main kind of experiences, and then obviously just applying academic experiences with working in a team, organisation, that sort of thing. But I suppose, yeah, I did get a week shadowing as well. I think one of the positive benefits of being a mature student was some of my friends in my undergraduate were medics, so they were now doctors. So I was able to reach out, and a friend of mine organised some. I shadowed her for quite a lot and got to meet her colleagues, which I was very fortunate to do. So I was able to, I suppose, use that. That was kind of just shadowing as such. So yeah, so it wasn't a very heavy work experience application.
Yeah, so it does sound like, I guess in tandem with obviously your academic experience, it must have obviously gone in your favour, because not to put other students down, but not many students apply to medicine with a PhD. So I guess, did you feel like advantageous in any way with your academics, or did you just approach it as in some universities look at a level playing ground, so you just need to do, I guess, the best of your ability to apply?
Yeah, I think so. I think it was kind of a weird thing in that, yes, you're right, you must think, surely I have some advantage, if anything, I've dedicated time, organisation, I've proved myself in the academic environment. But actually, I don't know how much it really counts, because a lot of that, the applications involve some sort of entrance exam. So, you have to do well in the entrance exam, regardless of your background. And then I applied to some graduate entry and then an undergraduate. And then I suppose as an undergraduate course, I don't know how much weight, to be honest, a PhD would show, because, an undergraduate also shows, that you're academically experienced at least, and it shows similar things. And I think I did apply to Oxford as one of my graduate entry choices, and I think, looking at the numbers, I think they do get a reasonable amount of people with PhDs applying. Yeah, more so that it's not completely uncommon. And on the Bristol course, there's one other, so out of 280 of us, there's another person that's come in post PhD.
Okay.
So I think it's not the norm, and I think also it depends what you think a PhD shows. We were just chatting before. Yeah. It's a training position, especially in the lab. I think it's different for different fields completely, but it was just training in the lab really, and you're training. You learn so many different skills, which obviously you can then apply to your application, and you can show many examples of problem solving, resilience. So, but I think you can get those from a lot of things, to be honest. So I think the title of PhD sometimes sounds I think it has a good sound to it, but I think actually there's a lot of other jobs, experiences, scenarios where you can pull out similar skills.
Yeah, and I guess that's down to, I'm probably not the only one, and I guess that's down to me being an undergraduate and obviously coming from high school to college, and me thinking, well, the top place you can get is PhD. You're a doctor,
Yeah.
that's I guess that's what we're told, and me being an undergraduate and these people teaching you being PhDs, and I'm like, well, they all have doctor next to their name, so they must be all like here. So I guess it's just a misconception. In obviously, you said it's just like a trainee position. So I guess just curiosity for my sake, where does it actually go from there? I know it's a bit off topic, but obviously you've got PhD, and then I guess where does it go from there? Because I'm clueless from that.
Yeah. So I think it's completely different for different fields, and I think there's some fields where you tend to get your PhD when you are a lot more experienced, and your PhD is a kind of a coming together of, your life, your kind of experience over your career. But for, I suppose, the biosciences, for the sciences, it's, if you want to work in a lab, if you want to become like a PI, or your lecturers, when you see lecturers in your labs, you have to have a PhD. So you apply for a PhD program. So it's called a doctoral training program often as well. So, and this is basically just giving you the skills to be a scientist. There's obviously a lot of other roles where you can go into science straight from an undergrad degree, and even straight from school. So I suppose it's just an academic, like, scientific training program. And then once you do your 3 or 4 years, you write your thesis, you're kind of showing that you understand kind of experimental principles and methods. You usually train in a certain techniques that you then kind of have evidence and experience in. And then the next stage is called a postdoc, so a postdoctoral position. So then you kind of, to be honest, it's similar, but it's showing your experience. So I did a short postdoc after my PhD, finishing off my lab work. So I held the position of a postdoc. And actually over this summer, I've got a summer project, and I'm actually going to be hired over the couple of months as a postdoc to represent the experience I have in the lab. So then you tend to spend a few years working under a supervisor as a postdoc, and you build kind of up the ranks in seniority, and then you start to look for your own funding and your own research. And then you apply for grants, and then you might start to become like a research fellow, or a research kind of an independent researcher. And then you might start to get your own PhD students, or your own people working for you, and then you move into more of a supervisor role. So, and those are the people that probably you see lecturing you. So there's teaching pathways and non-teaching pathways. And I think I don't want to undervalue PhDs. No. There's I do kind of speak for myself more in how I feel in the kind of the training position, but I suppose you are your own expert in your field. You tend to research something that, as with most science, very few other people are looking at. You're looking at this particular mechanism in this protein in this system, and you do become your own expert in your research. But I think in terms of a wider picture, you are just training to be an academic scientist, or if you then want to move out, change job roles. But I think it's
so it does sound like the way you've just described it. It does sound like there is many more steps than I would have imagined. Like you have to do a lot of supervision, and I guess there's some correlation across the board then, and like you have to do a lot more supervision before you actually get that responsibility. Whereas I don't think that's talked about much in undergraduate, to be totally frank. You just told these people are PhDs, and these other people have got PhDs. But I think you've cleared it up very well, and thank you for that. In that there's there's a lot more complexity to it
Yeah.
than I originally thought. So thank you.
Yeah.
So I guess within your application then, did you just sit the UCAT or did you also sit the GAMSAT as well, or the BMAT?
So I did the BMAT for my Oxford application. I didn't do the GAMSAT. One, because it looks kind of horrible and it looks like a huge exam, and also because I had only started really looking into the application, I suppose April, May time. I'd missed the January sitting, and then so I think there was a September sitting. But and also quite a big influence for my applications this time round was location. So I did ideally want to stay in the southwest. I feel quite settled there. It didn't quite feel the same as my first undergrad, where I didn't really, part of moving away was part of the whole experience. For this time round, I really wanted to stay in the southwest, so that really dominated my choices. So that's why I was kind of looking across to Oxford. I looked at Southampton. I applied to Southampton, and then Bristol, and then Birmingham. But Bristol was my kind of top choice for staying in the southwest. So the GAMSAT unis, I think I'd considered Swansea, but actually I think the UCAT and the BMAT covered the four that I was applying to.
So with the UCAT and the BMAT, how did you find the UCAT and the BMAT? Like, how did you approach it? Obviously, I guess the first question would be to ask, like, how many interviews did you get from the applications?
So I got my interview for Bristol, and quite early on. So I was in the first, I think, because my UCAT score was quite high, so I was in the first round of interviews for Bristol. So that was in November, maybe early November. But I didn't find out until March. It was a long time. And then as I left my Bristol interview, had felt it had gone okay. So it was quite, you have that post-interview rush, and I received my rejection from Oxford just as I left my Bristol interview, which was a mix of emotions. And then I got an interview at Southampton in the January, and I wasn't offered a place after, and I hadn't heard back from Birmingham by the time I got my place from Bristol. I'll be honest, I'm pretty sure that was a rejection, but they just hadn't said anything. So then I withdrew because Bristol was, easy to say as it was my only offer, but it was my top offer, like top choice. So I withdrew from Birmingham, but I'm pretty sure it was a no from them as well.
So I guess to go back to that question then, is there any way you particularly approached the UCAT and the BMAT? And obviously you said you got quite a good score in the UCAT, so is there any particular tips or any particular ways in which revision helped you that you thought useful?
Yeah, so I think the UCAT, I think just have to do it under the time pressure, because the questions themselves, apart from the abstract shapes, I could not offer any advice on those whatsoever. I still have no idea what's going on with them. But for everything else, the questions themselves are not super challenging, but it's the time pressure. So for things like the kind of the math, the arithmetic, or I'd written down like a list of the usual form, area of a square of it, that like simple things, but I kind of had gone through systematically and had those. I'd gone over those, but then it's just timings. It's the time pressure, I think, that is the challenge. So I had the book, and I was trying to time myself on the book a bit, but I found that quite difficult because it's just it's not the same as being on the computer. So I'd say, because it is an exam on the computer, revise and practice in the same way you're going to do the exam. I think the book questions are quite good if there's a section that you struggle on a bit more, that you can use different examples. But I think the difficulty is in the way you take it, not so much the questions. So time pressure and just practice. And I think I've used Medify, which I found really helpful, because I loved their little output stats and to show you where you are. That really appealed to, liking to see data and see how I'm performing. And I think just also pace yourself, because there is a limited number of questions and of examples to practice through. And I found I was doing, I suppose, evening and bits of it, but then the couple of days before, I did some solid, just few hours of practice. But I think there is just an element of, it's going to be how it is on the day. So I think it is a hard test to be quite consistent at, because, you know, it just takes a section that sometimes you do quite well in. I think on the day can make a huge difference. And if I'm remembering back, you know, I was really nervous. Try and take, you know, some breaths as much as you can, and use that minute in between the sections to just, use it. Don't try and rush through. Take a moment, take a breath. But yeah, just practice and just keep yourself under a time pressure. The BMAT, I don't know, go back and to a GCSE A-level chemistry, biology and physics. I definitely didn't do enough work for it. Physics especially, I didn't look back on, especially I think looking at the stats, grads tend to do better on the UK CAT but worse on the BMAT in general. Obviously that that doesn't say everything for everyone, but I think that was just a lot more content rather than the UK CAT doesn't really test knowledge, it tests, you know, different skills. So
yeah, it's hard because they say it's aptitude, but it's on the verge of being aptitude also, with you actually knowing how to take the test and knowing your revision. Obviously, that combines with the time constraints that you get. Obviously, if you've never seen the shape question before, you're gonna not know what to do. So I guess having time pressure on top of that just is not gonna fare well with your result. But
it's a difficult test. It's definitely difficult.
So I guess in terms of your interviews, were they all MMIs, or, well, presumably?
Yeah, so Bristol was an MMI, and then Southampton was a panel, which was 2 people and me, and then a group interview, which I did not enjoy very much at all. Not to put everyone off having it, like, it's still fine, you know, all interviews are quite, you know, they're not that fun. But yeah, so Bristol was 7 small stations, quite varied, I suppose, quite intense, because they have like a whistle and you've got the time. And I remember on one of them, I'd just gotten into a bit of a flow talking about stuff, and, you know, general advice is to be quite balanced, you know, don't tend to throw out points of view that are very polarized, show that, you know, you consider both sides. And I just built up this argument, and I said this sentence, which obviously you then go on to break down and say, but obviously, you know, you have to consider this. And I said it, and then the whistle went, so I actually just move on. So that was, you know, in that face of, I wasn't finished. I didn't, you know, that's not my whole belief. But it's fine. They, you know, they know, I think they know the system is limited, and that's your 5 minutes. So yeah, that was quite intense. But I did feel like I was able to leave the next station behind, because you're, you know, obviously it's quite stressful. As soon as you get to the next station, you're focused in on that. So you just don't have the time really to think about the one before. So in that sense, it's quite nice that you can move on. The Southampton interview definitely felt the group session was hard. Yeah, and I get what it tests. I get that, you know, you're working with your group. I just think it's quite difficult to have a genuine conversation when everyone's trying to play their strongest card and try to, you know, there was a lot of like, oh, thank you, Amber, that was an excellent point. If I can just add, and just, oh, thank you, that was, and you're just, I don't know, I find it quite hard to engage with. But that's fine, because I think as well, different universities have different ways of teaching and different systems and different ethoses. So if that's what they like to see from their students and it doesn't sit hugely well with you, then it might be that you also, it's not the right style of teaching or right style of course as well. So yeah, so there's definitely very different experiences for both.
Yeah, I think I can totally agree with that. With being in group interviews,
Hmm.
having to artificially show yourself because
Hmm.
everybody else is doing the same thing makes the whole experience just, well, I guess just artificial, in that
Hmm.
you're not truly showing yourself, and
Hmm.
you're almost showing false qualities that you might have. And I guess MMIs are kind of the same thing, with you having to be able
Hmm.
to build up that quick rapport with that
Hmm.
examiner, but almost almost you can control the MMI conversation a bit more than a
Hmm.
group.
Yeah.
Obviously, you've not got
Yeah.
6 or 7 other people trying to do the same thing. So I
Hmm.
guess with MMIs, how did you find them in such, obviously MMIs are well known for their role playing aspect.
Yeah.
So how did you
Hmm.
find that aspect of the MMI questions?
Hmm. So there was one during my round at Bristol, and I think it's a bit awkward. There's someone
Yeah.
watching you with the person that's doing the role play. I think you just have to get into it. Like, you just have to protect. There is a lot of role play in medicine and in the kind of the training, and from my understanding, all through, even when you're qualified, they use role play, throughout to train people. So I think you just it's uncomfortable, it's awkward, but you just have to get stuck in. You just have to suspend your belief that you're in an interview hall and someone's watching you, and you have to talk to them as if they are someone you want to find out something about, and just keep asking questions and just be a bit inquisitive, and yeah, and listen. So if they say something, listen. So I think, and practice. So especially if it's something you're not feeling so confident about, grab someone that you feel comfortable with and ask them to, make up some scenarios that you don't know what they're going with, and see if you can work out what questions to ask to get to the bottom of what they want to say. So yeah, find someone you're comfortable with and be uncomfortable to practice.
Yeah, and I guess a few people have said that with, especially with role playing
Mhm.
interviews, it's not so much how it's not so much who you break bad news to, for example.
Mhm.
It's how you break that bad news, and almost
Mhm.
knowing the process behind, for example, breaking bad news. And so you've been at med school for quite a while now. Did you feel like that was the case? And obviously, you again don't want to come across too robotic, but
Mhm.
you actually having to know the processes behind the questions that you're being asked to do.
Yeah, I think it's a bit of both, to be honest. I think you have to remember that you are interviewing to train to be a doctor. They don't expect you to come with, the skills of a doctor or even a medical student, because you're not there yet. I think it's more about showcasing, like you said, your temperament, your ability to empathize and connect. And it's more of those skills to show off. I think there's definitely merit in looking at, the GMC guidelines and looking at the framework of what they would like in a doctor. But I think it's unfair of them to expect you to be trained in doing that
Yeah,
scenario, because that's what you're there for, is to go on the course to get the training. So I think it's just a lot more about, yeah, showcasing your personality, showcasing that, and I think for a lot of people, you think, well, it's obvious, if you've got to break bad news, you're going to try and do it gently, and you're going to try and reassure. But actually, that isn't the case for some people, and I think it's just seeing how you react in that scenario and how you approach it. So, oh yeah, I would say don't worry about feeling like you have to do it perfectly or how it's expected, but just think about what the qualities are that you would
yeah,
like to show in that scenario, and what sort of person you are, to be honest. Showcase that, really.
sure. And so I guess looking back now, is there anything you wish you would have known before you began your degree as a med student?
Yeah, it's a tough question. I think I've definitely learned a lot, and I was saying the other week, I've come into it with having to study a lot for my first degree, and then there's not so much studying involved in a PhD, but I've done through a lot of processes of, coming across information, understanding it. And I don't know whether partly I'm kind of stuck in my old habits. And actually, I think I've had to relearn, look at how things are learnt now, not to make myself sound too old, but we used pen and paper, had some lectures on whiteboards, and what we were saying the other day, one of them used to get out a little projector with some acetone they'd write on. So, having the technology today, it makes it really different. And things like spaced repetition learning just wasn't really, like, there might have been a few people using it for a while, but especially during my first degree, it wasn't really something that people had explored. And I think you have to be open to, just seeing what's new, seeing what's out there, and finding a new style again, not expecting whatever you've used before to work. And that's definitely taken me a little bit of a while to get into the new flow of medicine, because there is just so much to learn. It's not necessarily super difficult, a lot of it, but there's just so much of it. And I think, perhaps I was a little stubborn in the first place of how to go about it. And it's taken me a while to get a new routine going.
And I think, I think medicine's unique in the fact that it's broad rather than depth. Obviously, almost any life science degree focuses in on that one subject. Obviously, me seeing it now in biomedical science, you're focusing in on those cells, those pathways, and I guess even it's more exacerbated with your experience in you doing your PhD thesis. So, I guess how have you found the adaptation from, obviously, you focusing in these one mechanism and then you having to learn the whole of the body again? Like, how have you found that adaptation?
It's been challenging, and I think also, again, I've been a little stubborn at times, just going over the things I like. So, there'd be some biochem and I'd be like, and I've definitely forgotten a lot since my first degree. I've spent 4 years looking at, like you said, I was looking at electron transport chain in mitochondria at one protein in one of the complexes. So, I've gone super niche. But I think anatomy, I had done no anatomy before. It's not my favourite, and there's a lot to learn. And I think, I have to be a bit more disciplined with myself to go over the anatomy, because it's just not my favourite. And I think when you found your niche before and you enjoy that, it is really easy to gravitate to it and just spend more time than you need on the information that actually you already kind of know. But I think that's okay to a degree, and I think it's okay to have interests, particularly interest in medicine. I think that's great, and I think it's obviously a long time till you specialise, but it's definitely a good thing to pick up particular interests. But you do just have to you need to know anatomy. Like, you need to know it, and I think it's just being a bit more disciplined in making sure you cover all the aspects, even if they're not all your favourite, or the different systems if they're not all your favourite.
For sure. Sure. I guess you've been in med school for, is it 2 years now? Well,
year and a half. Yes, I'm halfway through second year. Yeah.
So I guess it's a good chance to ask, are there any particular myths or misconceptions that you thought were stigmatized within med schools before you got there?
Yeah, I think there is a lot of work, but I think I definitely have lots of time to do other things. So I think the idea that when you do medicine, you don't have time for anything else. I think also it's competitive in that you've got a group of people who have had to do really well to even get on the course. But I've found generally people are really, really nice to work with. I think, again, it depends on different courses, but Bristol, we do a lot of kind of group work. And my group are awesome. They definitely share up a lot of their kind of resources and time and working together to understand things. Maybe that will change when we start to be ranked. I don't know. But I think I found it personally, and within the mature students, I found a really nice close group of friends that are very collaborative, and I found it a really nice space to work in, and a really supportive space. So I think the idea that you're going to come into it, it's going to be 24/7 working medicine, no one's going to kind of support you or help you, I think I haven't found it that way. I'm not sure what other myths or perceptions come with medicine.
So, some we've had is like you have to be super smart, or medicine is like an elitist degree only. People who go to like Oxford or Cambridge, like the ranking of medicine, medical schools, etc.
Yeah.
So I guess it's just to cover that. When you become a doctor, if you come from the lowest ranking medical school or Oxford or Cambridge, you're gonna have the same degree at the end of the day.
Yeah, and I think a nice thing they introduced at Bristol, and I think again it's especially when you've got students coming in that they're probably all going to be quite near the top of their schools or whatever backgrounds they've come in, and then not everyone can be top of their medical school. Some people are going to be in the top decile, some are going to just pass. But something they said was, just passing is still really good. We haven't set a cut-off line that's like, well, you're all right, you're not quite, you're good enough. If you've passed, you are good enough to be a doctor, which is a very high standard. So not everyone can aim to be the top in their year. And actually, if you're passing, you're doing really well. And I think it's not always easy to live that, in that everyone does like to get good marks, but I think it's a good reminder that you've gotten onto a very competitive course. You are you're learning a lot of material. It is very challenging. If you're passing, you're doing well. And if you qualify as a doctor, all med schools are challenging. They're all bringing you up to the same national like GMC guidelines. Like, you have done well enough. And I think also on the course, there is a range for different people with different skills to excel. There's obviously a baseline academic that you have to meet, but not everyone there is going to be super academic in that's going to be their thing. Some people are amazing at communication. Some people, they're just, you talk to them and you just want to tell them things. They're amazing at breaking news. They're amazing at explaining things. And, they might not be the top of the class for exams, but they absolutely have, a place. And the great thing about medicine is specialities vary so much that there's room for all different types of people, and you need different people on a team to fill those different roles. So I would say, there's going to be myths, and there's always going to be people that are top of the class, and there's always going to be people that are super competitive, and that's fine. But there is quite a lot of people doing it, that you will find people that fit with you and your view on it. And I think you just have to appreciate people for their own skill set.
Yeah, I totally agree with that. And I guess one of the biggest misconceptions is that obviously you coming from doing your undergraduate, doing your postgrad, is that everybody wants to be hitting those 75 or 70 or above to get those first. And unfortunately, that's where the competitive nature comes from. And I guess the misconception within medicine is that you just have to hit 40, or most universities 40 to pass, and it's more of you're there, you've made it. You don't need to be getting these 70 or aboves anymore, because you just need to hit the pass mark, and you're going to be the same doctor as the person who's the best in your class. I think that's where the competitiveness almost degrades, in that everybody who's made it is there now. They don't have to compete against 30 other people to get that one place. So I guess what's your take on that, and like how have you found throughout your education, obviously, the competitiveness with undergrad or postgrad, if you found it?
Yeah, I don't know. I'd say I'm a fairly competitive person, but more so with myself. Like, I like to do the best I can, and if I feel like I haven't, then I will be disappointed. But I think especially with medicine, it's so reductive to bring it down to a number. There's so many skills you need. We do effective consulting, we do exams, but you do clinical placement. How do you measure someone on how they've made a patient feel? And I think especially in medicine, it is reductive to reduce it to a number. And I think the competitiveness with other people, it takes away from what your own challenges are. I definitely need to put a lot of time into learning the material, but I don't necessarily find it challenging to understand because I've done a lot of it before. But I definitely feel like my challenges lie in the effective consulting and in building my communication skills. So those are where my challenges are. And I think if you need to reflect on yourself and where you need to learn, like, rather than worrying with other people. But it's so much easier said than done. And I think you can't take away the competitive nature in the sense of you are going to be applying for foundation jobs. They do rank you, you will get a rank. You can't get away from that. And if there are some specialities which are really competitive, and if that's what you want to do, it would be kind of, it's silly to just ignore that fact and just say, oh, it'll be fine. But that's someone else, that's not necessarily your challenge. If someone wants to go on that super competitive route, that's for them to identify their challenges and go after that. And if that's what you want to do, then, great, back yourself, get on that as well. But if that's not your, if that's not where your challenge lies, then it's not as worth thinking about that so much. So I think you have to, I suppose, identify where the role of that competitive comes from. And for some people, it's something they thrive in, or for some people it's an unfortunate consequence of the path they want to go down. But that isn't for everyone, and I think just having it blanketly is just it doesn't serve everyone. So it is a difficult thing where it is a competitive process, and getting into medicine is insanely competitive, and you are reduced down to entrance exam numbers and candidate number this out of so many, and for every 10 people that apply there's only one place. You can't get away from those numbers, and I think it's hard to remain confident when you are comparing yourself and seeing how you match up. So it's much easier said than done.
And I guess just to move on, what keeps you motivated? In such intense course like medicine, obviously you've been through some extremely hard challenges that not many people would actually undertake. So currently now, what keeps you motivated?
Sounds cheesy, but I just really enjoy learning. I really enjoy the material, and I like learning new things, and I like the challenge of taking something that when you first look at it and you're like, oh, I don't know what this is, and then you come out of it and you know things, and you can share that with other people. And I really enjoy learning new things. And like I said, I am quite compared to myself. I do like doing well. I do like to be personally quite measured by numbers. I quite like taking tests. I do quite enjoy that, because for me it's like, oh, there is a number, there is a measure that you can measure this by, but that's absolutely not for everyone. And I think so it's a challenge. I like to do quite a lot of different things, and I like the feeling of when you've completed them and you just keep going and you keep adding to it. And I just enjoy learning new things.
I think to be in such a competitive course, and to be somebody that's gone through all of the academic process, such as you need to be able to quantify the effort that you're putting in, because there is some degrees where you can't really quantify how much effort somebody's putting, but in such a degree like a science or a life science, you have to be graded, because unfortunately it's either fact or non fact, and it's you have to know how well you've done. And fortunately, well, that's something that you like, so I
do quite enjoy it. That's why I like Medify so much. And I think it's difficult though as well, in that there's skills that are really hard to put. You can't put every skill into a number, and I think I'm really nervous about OSCEs when they come up in the future. The kind of performative, like on the spot moments. I think I'm definitely much more of a considered, time to think it through. So that's we'll see how, so I think, not to talk myself down, I back myself to do it, but I'm definitely going to find them a lot more challenging. So I think it's again, I was saying it is reductive to reduce it to a number, but I do enjoy the progress of well, you've done this and you've done it this well, and But again, that's where my comfort is in the academics, and my challenges are outside those, and trying to, I suppose, understand how well I am doing, and learning how to improve outside of having a number attached to how well I'm doing, which is definitely a learning curve.
Yeah, for sure. I guess on the flip side to that question is, with such a long and strenuous course like medicine, how do you find time to plan for like self-rest or care, or if that be like extracurriculars or any sports? Obviously COVID has probably eradicated some of them, but I guess the question still stands.
I think I find that the more I'm doing, the more I get done. Like, I do really enjoy being busy and having a lot to do, and I think it's just, if you could organise your time and be efficient with your time, then I find I do get quite a lot done. So non-COVID times, I tend to get up quite early, like 5:30ish, do some exercise. I play sport some evenings in the week as well, for touch rugby, so there's definitely time for that. And I'm involved in some societies. We've talked about just getting the Mature Medics platform going, involved in some research projects, teaching. I teach for the charity The Brilliant Club still. I think my balance of self-care is not always in the right place. I do just enjoy, I really enjoy a lot of the things I do. So I don't always relax in the like normal sense of the word so much. But while I'm enjoying them, it doesn't really feel that kind of cliche of, it doesn't feel like work while you're enjoying it. But I think there's definitely time to stay organised. I use little like timers. I have like a breakdown of all my like tasks, and then I set timers while I'm working, so I can get an idea of how much time I'm spending on things. And also, while the time is going, I won't kind of play on my phone or do other things, because otherwise the data will be inaccurate for how much time I've spent on that job. So if I know the time is going, it helps me focus in on that task, because I want to know how much time I'm spending on it, so I tend to then not be distracted much. And then I get a breakdown of coloured graphs and output of how much time I spent, which I really enjoy. So I think there's definitely time. I think it's something I definitely work on to not take on too much, and I think especially in something like medicine, there are so many opportunities, with social side, with sport, with teaching, with societies. I've definitely had research avenues opened up because of the position I'm in. So it's just a case of being mindful of it, but there's definitely time.
Yeah, I totally agree with that, and I guess it goes back to the saying of run your life around medicine, not let medicine run your life. In that, again, when you said there's so many opportunities and you can go down so many different pathways, and unfortunately, you're just learning the whole body, which is kind of detrimental when you know how deep the body can actually go within your graduate role. So it gets a bit almost tedious that you have to cut off at a certain point, and you need to say it's enough. You don't need to go any deeper than this. And I guess that's somewhere where you do need to time manage, and I think it's effective with, especially you being almost analytical in you knowing how much time you need to spend on each task, which is really surprising and really great, to be honest.
I set myself goals, because I think also you have those tasks where you're like, oh, I'll just do this, it'll take me an hour, and then, or an hour a week, and then you realize actually you're spending quite a few hours a week on it. Or even especially with medicine, you're like, oh yeah, I do quite a lot of medicine, and actually maybe because you're doing quite a few other little tasks, you don't spend as much time on it as you think. So, and also I like collecting the data as well. And I have a very thorough to-do list. I use Asana for to-do lists as well, and I have a very thorough to-do list that kind of can link into the time tracker as well. So again, I enjoy it. It's not for everyone.
No. I mean, I think most people can relate. Like, I think I saw you used Notion because yeah, like
yeah, I love Notion.
I just got into using it, and it's again with Notion you can almost go too in detail, and if anybody's used it, you can almost track every bit of detail of your life, and it's almost knowing when to stop. But again, it's having those tools and knowing how to use it correctly, which makes it effective. I guess. What does a week in the life in med school look like then? Obviously, I guess pre-COVID, in COVID would have differ tremendously, but
yeah, I think especially for the preclinical years, so years 1 and 2 for Bristol before you go into placement, apart from the physically being in a lecture theatre, that hasn't actually changed very much in terms of what we're doing. It's obviously just how we're doing it. But Bristol work in 2-week blocks, and you'll look at, and it's case-based learning. So at the beginning of the block of the 2 weeks, you'll have a case that will be based around the system. It's actually symptom-based learning at the moment. So they look at symptoms. So we had chest pain, breathlessness. We're on like a GI block at the moment. So like a abdominal pain, and we have 5 hours of CBL every 2 weeks. So we have 2 2-hour blocks and then an hour. And that's where it's quite independent. We work through the case, identify what we don't know, what we're interested in, what we need to learn more about. And then in the second 2 hours, everyone's done some work. We feed back and we kind of share our findings with everyone. So that's quite nice for you to pick out bits that are more, it's not so prescriptive. It's kind of, oh, well, actually, we don't know as a group much about this. Well, actually, I can explain this. So that's very nice and collaborative. We have roughly 10 to 12 lectures per 2-week block spread over the 2 weeks. So not a huge amount for that, to be honest. And then we'll have an anatomy set at the moment to work through. Obviously, pre-COVID would have had time in the lab, in the anatomy lab, and then also like a kind of biomedi type practical link to it as well. And then they put on like extra kind of cross-disciplinary tutorial or events or extra tutorials, or like a tutorial on paper reading, usually once, something like that every 2-week block. So it's not super intense always with the contact hours, but I think that then goes with a large expectation that you then spend the rest of your working day, learning, with the resources they give you, learning the rest of the material. So it's quite varied. I do enjoy that. And we have placement. So on a Thursday morning, we have effective consulting, which is a tutorial where they get in actors. And actually last Thursday just gone, it was my 3 people tend to consult per block, like per tutorial, and I was one of them. So I had to talk to this actor, and they were pretending to be a patient, and had to talk through a scenario. And then on the second Thursday, you have either GP or secondary care placement. So with the GP, there's about 5 or 6 of you on Teams at the moment, but we conference called in a patient, so they are working, hard to get patient involvement still. And then secondary care, we might talk to like an expert patient. So they do try, and I think Bristol try and get a fair amount of quite early contact with patients, and which is really it's nice because it reminds you why you're doing it, and you get to develop those skills. And so I say it's a very varied timetable, which is nice. It
does sound like it's very self-directed. Then you're not really given. So I guess some schools do it different, and you get taught what you need to know for the exam when it comes up, and then other schools just say, this is the topic you're going to learn. Go and learn it. Obviously, you're a bit limited in knowing what to learn, because again, you can go as deep as you want, you can go as broad as you want, but I guess it does sound like it complements nicely within the patient contact early, and so the PBL lessons that you say that you have.
Yeah, and they give you learning objectives, so they don't kind of just let you go completely free. So with every kind of lecture and with every case, they give you learning objectives across all the different, lectures, labs, anatomy. We do quite a few like simulations as well. So they'll have the simulation dummy, and so like in chest pain, they were mimicking, particular heart rhythms and things. So, and then across those you'll have learning objectives. So in that sense, you do know what a framework within to learn. But especially because the lectures are quite often just pre-recorded at the moment, there is a lot of kind of independent getting with things, which I personally suits me really well. Get to manage your own time and do things in your own way.
I'm worried about going back now after having these pre-recorded lectures. You can just wake up a bit later, jump on, they're all there for you. It's it's a bit too convenient.
I
guess so. What's your vision going into the future then? Obviously, you've got all these degrees under your belt. You're gonna have a medicine degree under your belt soon. So I guess, where do you see yourself in the future? Obviously, you're only halfway through your degree, so you're probably not expected to know. But I guess, where can you see yourself going within the future?
I think I definitely have a clearer sense of where I want to go based off of kind of, I suppose, the experiences I've had. Whether that's what's going to happen, who knows? I might start a placement and it might completely change my mind. But at the moment, I would love to be a clinical academic. So at the moment, I would expect that I'd apply to the academic foundation program. I'm already, I've tried to keep up with some research projects. I'm going to be doing I'm going to be spending my summer in a lab on a new research project. I would also I teach for this charity, the Brilliant Club. I would quite like to be a clinical academic with teaching time. So I would like to continue keeping up my teaching, potentially get a teaching qualification within medical education sometime in the future. And I think the field of genetics, maybe kind of that side of things, I think is where I'm leaning more towards. I definitely know I'm not suited for A&E type, that's just not my strong point. It's not what I enjoy. So I think something that's got a very heavy academic base to it, but I'd love to be really specialised. So, you see patients that are, but with an academic grounding, and then you can research, find out things, and then see patients that fits with. So that's the vision, but there's so many steps along the way, and there's so many points where you have decisions of what to apply for, and it's still fun, challenging to get funding as a researcher, even within the medical field. So lots to work on still.
I feel like what you just said suits your past experience very well. It would have surprised me if you would have came out and said you wanted to do orthopedic surgery after your 8 years at university. But it does sound like it's logical sense if you wanted to progress. Well, you must have liked it because you did 8 years of it, so something that you loved before. I guess for future medical students watching this video, then, are there any golden pieces of advice you give somebody going through the application process?
So I would just say as well, so that's kind of the fact that it leads on logically has been a huge part of the fact that it doesn't feel like I'm stepping back so much. I've gone back to undergraduate after a PhD, but actually it does kind of fit as a winding road, but it does fit as a road going forward. So I think, medicine's a long career. There are so many possibilities, and you can utilize your previous experience. So, even if you are a grad and you're a bit older, it's not like you're starting again, because you'll, even whatever field you go into, you'll use your previous experience. So it is just kind of a continuation. But my golden tip would be just put yourself out there. Ask, if you want to be involved in something, just ask. If you want to try research, send some emails to some people in the field that you're interested in their research. If you want to join a society, or if you think there's a gap for a society, I think just put yourself out there. It might not always come off. Some people might be busy, some people might not have space, it might not be the right time, but more often than not, if you're interested in something and you find other people that are, you know, they'd love to have you involved. So yeah, use the position while you're there to follow your other interests.
And I guess that holds more weight coming from somebody that's actually gone through all the process and holds that hierarchy of, obviously, these undergraduate students, most of them going to be applying, will not know to ask their lecturers or ask their other PhD students. And I think it's almost not well known for students to email them and say, "Oh, can I jump in the lab?" Because you all feel like a liability at that point.
It's scary as well. Yeah, it's intimidating to just be like. But I think there's a difference as well. If you just say, you know, "Can I do a summer project?" You're leaving a lot of work to the other person to be like, "Well, what are you interested in? Why do you want to do it?" Whereas if you put genuine interest out there and you say, you know, "I really like this lecture," or "I liked, you know, I've been looking at this. I'd love to learn these skills. You know, would you have room?" You know, then there's very few people people are in these fields because they're interested in them. You know, that's, you know, it's why they're there. Generally, people love to share that. And like I said, don't be disheartened if not everyone jumps on the opportunity, because, you know, people have got different timings, different capacities for students, but they might know someone that then could be interested. So many opportunities I've had just from putting it out there that was something I was interested in doing. So yeah, and value yourself. You've got good skills to bring, you know, like you've gotten onto the course, you know, you've got experience, you've got an interest, like you've got value to bring. So like back yourself with that as well.
For sure. And I guess finally, for someone starting their first day out at med school, what would be your take-home tips for that student?
I'd say there'll be times where it's, you know, a bit overwhelming, and there's times where you maybe don't feel like you're, like we talk about the competitive, like, you know, you're always best there, but you have your place there. You know, it might be hard and you might not always understand things, but, you know, that's okay. You take it day by day. Like, it's a long course, it's a long career. There's going to be so much information thrown at you, but just take it piece by piece and it will get there. So now in second year, there was stuff in first year that I suppose didn't have the capacity to take all in, but now I'm starting to think, well, actually I know that from there, like it will come together. But the first few weeks they can be really overwhelming. There's new people, there's a lot of information, but you have a lot to bring to the course, and just keep a little bit step by step by step. Don't expect to learn, you know, be a doctor but at the end of your first day. It will take time.
And I think it's the point at which some students have been doing this for a year, 2 years, some 3 or 4, and it's almost that imposter syndrome of when you actually get there and all we all know is just the application process. Obviously, me speaking to you and all the other guests have been almost like a light in what's over the wall of actually being in med school, if you want to put it that way. And obviously we just know the application process and how hard it is, and I think it's great that we get to see what it's like, and the actual people that get in sometimes have to apply 3-4 times, but at the end of the day they're all human. They're not these academic excellent people that have all got in. Some are, but not everybody is perfect, and the people that make it are just the people that persevere. They're not anything special, just people that persevere, which is
no, I think so. And I think med schools could fill their spaces 2-3 times over with excellent candidates. Like, I think it's hard to do but easy to say, but just to not take it personally during the application process, it's really dehumanizing. You're put down to a number, like, you know, like you were saying, you look at me like, oh, you've got a PhD, and I kind of felt really awful during the application process. You kind of feel like you put all these skills and you put your heart into the application. You're like, I've done this experience, I'd love to do this, I feel like I'd be really good at it, and you're just like oh no, not even to interview, not even to this, oh, what was your UK score? What, what number are you in this? You're in a spreadsheet, and it feels like all the kind of heart you put into it doesn't count always during the application. And I think it's a really tough thing. And I think it's a problem that's hard to solve, because there's just a lot of people that apply to medicine, and they are generally really good candidates. So I think, absolutely I think there's a balance between reflecting on what you can improve on. So if there are, there might be reasons why you're not getting in, because you need to, look at your experience in this, or you need to reflect on your own, how you view these scenarios. But there's also just a balance of, it's just really tough, and you could be an excellent medical student and doctor, and just it's not your year. Maybe your entrance exam score, which again is only one reflection of who you are and your abilities, wasn't quite in the boundary, or you didn't get across in interview exactly what you wanted. So it is a really tough process, and med school is tough in a different way, but it's not the same at all as the application process.
It's just, don't give up. Just don't give up.
Yeah.
If it takes you 2 or 3 times, don't give up, because if you keep applying, you're going to get there eventually. It's just what you said, improve on what you didn't do so well on, and in those coming years you're going to be good enough to actually successfully get through the application process. So again, thank you for taking the time out of your day to come speak to me. It's been a real pleasure to speak to somebody with, I guess your expertise, and somebody that's gone through, again, all of the academic career in research, and then had a career switch, but has still successfully been able to link everything together. And I think it's really unique, but really rewarding within yourself as well, really. So thank you. I guess finally, for our viewers, is there any way they could get in contact with you?
Yeah, absolutely. So I run a Instagram page called Doctor to Doctor, and also the Mature Medics platform. So absolutely check it out. Trying to grow it with some resources, and kind of a space where, like this channel, just helping people in the application once we're in medicine, highlighting mature students. So yeah, I'd be happy to field any questions. Love to talk to people wanted to get into medicine, because it is tough. And so Doctor to Doctor, and Mature Medics.
Mature Medics. All right, perfect. Thank you for that, Amber.
No worries.
Thank you.
Thank you. Bye-bye.
Bye.